Hello everyone, my name is Jenna Kleibecker and I will be talking about epilepsy. Epilepsy is a disorder of the brain characterized by repeated seizures. A seizure is a sudden alteration of behavior due to a temporary change in the electrical functioning of the brain. When a person has epilepsy, their brain's electrical rhythms have a tendency to become imbalanced, which results in repeated, unprovoked seizures, and that is what makes them difficult to predict. Depending on which area of the brain the seizures resonate from, it will determine the initial symptoms of the seizures. This, in turn, often reflects the functions of that area of the brain being affected by the seizures. The history of epilepsy dates back over 4,000 years, with the first information being evidenced on a tablet which described the different traits associated with epilepsy. During this time, the episodes of epilepsy were believed to be rapid contractions that were caused by evil spirits invading the body. The lack of medical information on the mechanisms of the brain leads to a vastly ineffective treatment, which was spiritual intervention. As medicine progressed, an idea arose that the electrical discharges in the brain were responsible for causing seizures. This idea was introduced by Dr. Robert Bentley Todd in 1849. His hypothesis was then confirmed by using the MRI machine on rabbits that was created by Michael Faraday. The scientific findings of epilepsy, including the localization of lesions that could produce seizures, were then put into the text Study of Convulsion by John Hewlings Jackson. The EEG was invented 80 years later by Hans Berger, confirming that the convulsions were the result of abnormal electrical activity in the brain. With medical research in epilepsy rapidly advancing from the initial idea, in 1935, it was discovered that there was no change in cerebral blood flow in patients during a seizure by William Lennox. Epilepsy is a multifaceted disorder with a wide range of complications that can be unique to each individual with epilepsy. There are symptoms that can happen before, during, and after a seizure. Some symptoms that happen before a seizure actually occurs is déjà vu, jamais vu, noticing different smells, sounds, or tastes, visual loss or blurring, strange feelings, fear or panic, often negative or scary feelings, pleasant feelings, racing thoughts, becoming dizzy or lightheaded, having a headache, having nausea or other stomach feelings, and numbness or tingling in a part of the body. Some non-physical symptoms that may occur during a seizure is loss of awareness, which is often called blacking out, being confused, feeling spacey, periods of forgetfulness or memory lapses, distracted or daydreaming, loss of consciousness, unconscious, or pass out. They may be unable to hear, sounds may be strange or different, may smell unusual smells, may have unusual smells, often bad smells like burning rubber, unusual tastes, loss of vision or unable to see, blurry vision, flashing lights, formed visual hallucinations, seeing objects that aren't really there, numbness, tingling, or electric shock like feeling in the body or the arms or legs, out-of-body sensations, feeling detached, déjà vu or jamais vu, body parts feel or look different, feeling of panic, fear, impending doom, and pleasant feelings. There are also some physical symptoms that can occur during a seizure, which is difficult talking. They may stop talking, make nonsense or garbled sounds, keep talking, or speech may not make sense, unable to swallow, experiencing drooling, repeated blinking of the eyes, The eyes may move to one side or look upward or staring. Lack of movement or muscle tone, unable to move, loss of tone in neck and head, may drop forward, loss of muscle tone in body and the person may slump or fall forward. Tremors, twitching or jerking movements, rigid or tense muscles, part of the body or whole body may feel very tight or tense, and if standing may fall like a tree trunk. Repeated purposeful movements, convulsion, which is a person loses consciousness, body becomes rigid or tense, then fast jerking movements occur. Losing control of urine or stool unexpectedly, sweating, change in skin color, pupils may dilate or appear larger than normal, biting of tongue, difficulty breathing, and heart racing. Lastly, there are seizures that can occur after the seizure, which include slow to respond or not able to respond right away, sleepy, confused, memory loss, difficulty talking or writing, feeling fuzzy, lightheaded, or dizzy, feeling depressed, sad, upset, scared, anxious, frustrated, embarrassed, ashamed, may have injuries such as bruising, cuts, broken bones, or head injury if they fell during the seizure, may feel tired, exhausted, or sleep for minutes or hours, headache or other pain, nausea or upset stomach. They may be thirsty, have general weakness or weaken one side of the body, urge to go to the bathroom, or lose control of bowel or bladder. Epilepsy is diagnosed by multiple different ways. A neurological exam can be performed to see how your brain and the rest of your nervous system are functioning. An EEG is performed to see your brain's electrical patterns that relate to seizures. It is considered to be the most important laboratory examination for the diagnosis of epilepsy. An EEG should be performed while the patient is in a state of wakefulness, sleep, photic stimulation, and hyperventilation. A 3 Hz spike wave complex or Rolandic discharge is considered a specific EEG pattern that points towards an epileptic syndrome. This is because the localization and lateralization of the epileptic EEG foci can explain the clinical manifestation of the aura and seizure manifestations of the patients. Brain imaging such as an MRI, CT, or CAT scan will also be performed to see changes in the way your brain developed that could lead to seizures. The long terms of epilepsy. Epilepsy has the possibility of impacting a child's aspects of development and functioning. As a result of this, children are at increased risk for unsuccessful school experiences. An example of this is due to their developmental delay, difficulties in social engagement with peers, which is due to being unable to participate fully in physical activities due to occurrence of seizures, and possibly missing school because of these seizures. So this would be missing out in physical activity while at school and in the bonding with peers at school. Inadequate social skills, and poor self-esteem, which is due to the emotional and behavioral issues that comes along with epilepsy. Epilepsy and seizures can develop in any person at any age. Seizures and epilepsy are more common in young children and older people. New cases of epilepsy are most common among children during the first year of life. The rate of new cases of epilepsy gradually go down until about age 10 and then becomes stable. After age 55, the rate of new cases of epilepsy start to increase as people develop strokes, brain tumors, or Alzheimer's, which all can cause epilepsy. Some treatments for epilepsy may include anti-seizure medication, surgeries, or vitamins, minerals, and complementary and alternative medicine. Thank you for listening to me talk about epilepsy, and I hope you enjoyed learning about it.